today's class we will see about the survey and how it is been getting interpreted, why we are doing survey, who is doing survey, what is the purpose of survey, what is the benefits of survey, what are all the different methods of doing survey, how to draw the area map, all these things. What is survey? Survey in the sense it's a collecting of gathering the information from the group of people. Who is doing that survey? The survey is mainly done by the government. How often they are doing the survey? Every 10 years once they are doing a survey. Not only that, sometimes epidemiologists doing survey for so many studies and some researchers also collecting survey. What is collected in the survey? Survey is collected what information? Information is called in the form of a data. What is data? Data is called the piece of information. So these informations are collected from the people. Not only information about people's opinions, about their behavior, about their options, and why they are doing survey to find out the economic conditions of the people, to find out the sometimes health surveys or giving information about the health status of the individual, and what is the endemic and epidemic diseases are present, what is the strength of the diseases, what is the prevalence of the diseases, what is the incident rates, all these things we are doing a survey. Only epidemiologists are doing survey. We nursing students are not doing. Yes, nursing students before taking their community health posting in the area, the teachers are getting oriented and making the students to do the survey. How this community health nurse has to do? First, she has to go to the village in a form of transact walk. While going walk, what she has to observe? She has to observe some of the landmarks. What is called landmarks? Parks, some of the temple, some of the monuments are there, some of the name of the streets, and hospital, school area has to be noticed. What is the name of the streets? They have to notice. So when they are sending the students, at least 2 students, they have to walk and see draw the area map and the number. How they are starting to do their survey? So for survey, they divide the students. Each streets may be this side 2 students, this side 2 students. They will cover the area. If there is a 10 houses are there, then what is the main point the teacher has to remember while sending the students for survey? Never send any students alone to the community area. You know what are the consequences. Most of us, we are having a female children. We do not know the area. Sometimes robbers will be there. Sometimes in a village area you are going, okay, village is safe. Sometimes slum areas will be, drug addicts will be there. So we do not know. Always send the 2 children in the house. What they do, they collect the primary data. How do they collect? They will have a form. And how do they will give? If there is a confusion, if this girl is taken a survey this year, how the other girl is coming? There is no communication, right? Some of this one too, in between the 2 streets, the houses will be there. So what you have to do? The nurse who is doing this community health nurse has to give, there will be a house number. The nurse has to give the survey number. Are you understanding? So this survey number tells, she has given a survey number in their family. It is well known that the other nurse will not be covering the area. What is the benefits of this? While collecting the information itself, then the community health nurse will be coming to know that who are all present in the house, old age, what is the family, what is that. So it is giving an opportunity to collect the data, primary data from them. It will be helpful for her to take their research study or what is the plan for their health education. So this is how. So how you have to motivate the students while drawing the area map. They have to put this arrow, like what is, they have to state what is the north, east or south, and then they have to know what are all the landmarks while they are drawing. And then every street there will be a name plate. This is the street name will be there. The houses should be marked. So survey has got a very great impact in the healthcare. In a sudden epidemic outbreak in 1820 in London, they have taken a survey who is affected, because there is, I talked to you about community health nurse and epidemiologist. They are both will be different. They will find out the root cause of the problem. They are not like a doctor treat the information. So when they collected survey, they have put dotted who all the patients are coming, what is their address. They put the red mark around it. They found out that the well around all the house people are getting the cholera. So what they have done, immediately they went and closed the well. immediately cholera has been reduced. So this is how the survey is a very good epidemiological approach. So what is the epidemiological approach survey means? They will helpful for community program planning. How many are there, if there is a many children are there, or many adults are there, or the leprosy patients are there. So what is that? They can diagnose the community, they can put the program planning, they can see the rise in disease of the fall, the healthy status of the community health nursing, and wealth status of this community area about the village can be find out. How the village can be find out the health status? How do they know? So how many cows they are having, how many animals they are having, and how many the lands will be. They will not be very rich, showing us like the jewelry, they will not wear it, but these animals and others are their health status, I mean richness, wealth status, not a health status. So this is the information being collected. Who is collecting this one? Okay, community health nurse is collecting for the particular area she is covering, because she has to complete her course. Otherwise, who is doing that? Under the government, so many enumerators are doing this one. Primary school teachers, there is a paper, data sheet will be given to them, or the epidemiological data sheet will be given. Either the doctors or the enumerators will be, they will be ticking what is, how many are there, vehicle are there, distance where, what is their food habit, their behavior, everything will be collected. So this is called the primary information. The piece data means it's a piece of information, it's a primary information. It is mainly useful for the research purpose and administration purpose. So the raw data has been put it into the tabulated and will be put it in a form of a pictorial representation, figures, pie diagram, bar diagram, histogram. So it will be the bird's eye view. In a one view, you can see how many children are there, how much percentage of the adults are there, and what is the age group. Like that, in a bird's eye view, it will be useful. So it will be helpful for the people to see in a one look what is present over there. Okay, let us come. Okay, whatever, you got an idea about what is survey and other things. Okay, we have collected the data of informations, and we have seen what is called vital statistics or health statistics in my previous video. Now you have collected the data, how you have to interpret it. For example, government is collecting the 1 year like a grand survey in a 10-year once. That's what we are talking about. So the population survey, right or not, door to door they are going and checking this one. For example, how do they interpret? How do they tell it's my maternal mortality rate in this district or this village? How do they? You take one example. Here the population is 5,20,000, death is 4,000, birth is 10,000, stillbirth is 300, maternal death is 30, and will be the death under 1 year is 100. Let us see. Let us see what is called maternal mortality rate. Maternal mortality rate, in the sense the total number of maternal death divided by total number of birth into 1000. So what is the maternal death? How much maternal death? Maternal 30. The total population like a birth, total birth is called the 10,000 and 100. So what is the maternal mortality rate? It is 3. Understand? Infant mortality rate. So infant is less than 1 year. So we are writing death under the 1 year and total number of birth into 1000. So 100, this one answer will be 10 in that particular village. And will be the neonatal mortality rate. So neonate is 0 to 28 days. So number of the neonates death and the number of live birth into 1000. Okay. What is the prenatal mortality rate? Prenatal mortality rate, it is the formula saying that stillbirth plus death under 1 week. Understand? By the total live birth plus stillbirth into 1000. Understand? So it is like a 31.55, 31 to 32 in the sense prenatal mortality rate in the particular district or village, you can say. Then you can see one example. The total population of Bardhaman is, you can take, it's an example, just imagination. It's not, it's more than that. Population in West Bengal is very high, but I just given in a Bardhaman small village. You can take 2-3 villages together, you can take it. 210,000 population. The new TB cases or the Bardhaman is 200, existing TB is 770. What is the incident rate? The formula of an incident rate is number of new cases divided by total population into 1000. So what is the number of new cases? New cases maybe 100 or 200. You have to put it. Number of new cases. It's like a 200. It's like a 200. You have to put it So so you can find out that what is the 200, not 100 you have to put. Okay, you can existing new cases new cases 100 you can keep it. So what will be the prevalence rate? Prevalence rate always will be the existing case and plus the new cases you have to add. Here existing case are 770, new cases you can keep it as 100. If it is 100, it will be 870 when you are doing. Its answer is of a prevalence is 417. So how it is? For example, this is a tape, water is falling here, the water is already there, okay, already there. This is the incident, this is the incidence, this all called prevalence, this all called the prevalence. This is called death or recovery, either they will die or will be recovery. So this is the thing told by the epidemiologist. What is the water falling inside this one is the incident. Prevalence is already which is having, either will be death or this one. So this is a pictorial representation of this. Okay, next one more example we will see about it. Like total population is a 5,20,000 and death is 4,000, birth is 10,000, stillbirth is 300, maternal 30, death under 1 year 100, new leprosy cases are 20, old cases are 80, number of death within the 28 days are 45, and number of death within 1 week is 25. Let us see what is the incident rate of this one. Incident rate is number of new cases is 20. Total population is 5,20,000 and into 1000. So what is the incident rate? 0.038 is the incident rate. What is the prevalence rate? New cases plus existing cases by divided by total population. Total population into 1000. Total population into 1000. Not always 100. It is always 1000. You see, 20 plus 80 divided by 5,20,000 into 1000. So 0.19 will be the prevalence rate of the leprosy patient in the Bardhaman village. Okay, what is called the crude birth rate? The crude birth rate, it is like a total number of birth divided by total population into 1000. So what is the total number of birth rate? Here will be given about 10,000. So 10,000 divided by population. So crude birth rate is 19. What is the purpose of collecting the crude birth rate? You can plan for the newborn immunization program or family planning program, anything in this particular village. Asha can be trained accordingly. Crude death rate, it is nothing but total number of death divided by total population into 1000. So what is the total number of death? It's like a total number of death is a 4,000. So total number of death by plus total number of death by the divided by the crude death rate. You have to add what all the total number of death. Here only 4,000 death. So death in 1 year, death in within 25 days, to death within 28 days, all has to be added and will be divided by, that's called the crude death rate. Next we will see about what is called ASFR, GFR, TFR, CBR. What is ASFR? Age specific fertility rate. Age specific fertility rate is very important. Every year, the 5-year difference has been given. Here if you see, the fertility rate will be always taken, any data collected, it is taken by the mid-year population. It is not taken collecting data from the January or in the December. It will be June, July they are collecting. So this is a mid-year population. Every age between the women. Why this is 15 to 49? It is a reproductive age of the women. If you see very young age, the reproduction age, also the birth rate is very less, and the 45 to 49 also birth rate, number of birth is less, but high reproductive age in this 22 to 24 or 29 to within 29 is the reproduction, the birth rate is very high. So what's happening here? Here they have given how to bring the age specific reproduction rate. So first in this fall, total fertility rate you want to find out when the data is collected from the national NRHM data is given you. So bring the mid-year population. First you have to tabulate those data and find out what are all the birth rates, find out the total birth rate in particular period of the time. First you find out the ASFR to find out the other statistics of TFR, everything. So what is the interval rate they are given? Like this only they will be given. What is ASFR? ASFR, number of live births occurred in a specific age divided by the mid-year population in a specific age into 1000. For example, you take 15 to 19 year. What they have taken? Number of live birth is 750. What is the mid-year population? 22,000 into 1000, so 34. So each age specific fertility rate has been calculated on the basis of this formula. This has been tabulated and the total one has been put it inside here because it will be helpful for the total fertility rate. Okay. Next we will see about this is how we have calculated about this. Every age specific population has been calculated. Next we will see about what is TFR. What is the formula? It is called the total fertility rate. Total fertility rate is a sum of all fertility rate of each groups. What is sum of all? This sum of all fertility groups in the totally how it is coming. So what is that amount? 349.3 is the one. And into 5 years. Why we are putting 5 year? Because the interval is a 5 year. 22-24 is a 5 year period is the interval. That is the reason we are putting into 5 year divided by 1000. So when you are getting it, it is like a total fertility rate is 1.75. That means 1 or 2 child are born. This one is called the general fertility rate. What is general fertility rate? Number of live birth divided by number of women in between 45 to 49. So what is the number of generally what is? So this is the number of live birth. This is the age specific women in a various reproductive age from the 15 to 49 year they are here. So these two data has been collected. Total fertility rate, this data ASFR has been taken. But when it is a general fertility rate, we are taking generally from all the women, from this generally how much birth is occurring. So this data has been taken into 1000. So GFR is 64. Okay. What is called crude birth rate? Number of live birth by the total population. Just these two data are been taken. Number of live birth and this one has been taken. This is about this 16. Crude birth rate is 16. Understand? So this is about, we have seen about ASR, GFR, TFR and CBR. So ASFR, first you have to age specifically you have to collect by the mid-year population into live birth. This is the formula. Live birth is occurred by the mid-year population. Once you collected this, then you can go for the TFR. TFR we are collecting by the total of this population into 1000. Other one, general informations are collected by these two datas. And by the crude birth rate also used by these two data and general fertility rate also these two data has been used. But in the crude birth rate we are using the total population, Bardhaman total population, we are using the 5 lakhs population we are using. That is the difference you have to see. Crude birth rate ka we are putting 5 lakh population, but here general fertility we are putting the fertility woman population, but crude is totally we are telling in the 5000 population how many children are born we are telling. That is the difference. We have put it 5000 population in a crude birth rate, but it is a fertility, general fertility we are putting the maternal population we are putting. Okay. Same thing. Here also I have given the Bardhaman population like 5 lakhs. This is about this. We have found out the total population. This is a male and female. What is crude birth rate? Same number of live birth, total population. Crude birth rate, we are taking 5000 or 5 lakh population, right? Or total birth rate plus 5000. 5 lakhs into 1000 is the crude birth rate of this particular area. This all will be counted by the mid-year population. Here we have given male is to female. How many males are there for the female? This is called the general fertility. General fertility, where the data collected from? Here, number of women. This is the data collected from the denominator. What is the nominator? Nominator is the number of live birth. This is the data, put it. So it's once again I am just telling you, age of age is specific. You know what is the age is specific? With these two data we are putting into 1000, this number is coming. That's called the age specific. One I have calculated and shown you here. 1900 plus 2000 into first one like 1900 divided by number of women into this one we have put it here. So this one like that you have to make it ASFR. Why we have to ASFR? We have to do because total fertility rate you need the total ASFR. The total ASFR is 693.1 and into 5. Why ASFR into 5 by 1000? Because it is given the 5 years of gap between the age group, like a maternal age group of the mother, from the 15 to 49, their reproductive age group of the mother. Understand? GFR is a gross reproduction rate. Are you understanding? What is called the gross reproduction rate? Total number of female birth by the total birth, male and female, into TFR. So this is called the GFR. One important thing next is called the net reproduction rate. The net reproduction rate, currently government is striving to bring less than 1. What is called net reproductive rate? The net reproductive rate, it is taking the sum of a total number of female children born, and these female children live until their reproductive age, and these female children able to produce the children how many number, that is called this one. That is why this formula states that sum of all female birth into survival rate divided by 100 into 1000. So this net reproduction rate will be helpful. It is predicting the future population. It's a very important one criteria. Currently, Indian government striving to bring it less than 1 as a net reproductive rate. So, hope you have understand how these health statistics or the vital statistics has to be get interpreted. What are all the different, what is the importance of survey. Then one more thing I forgot to tell. The students are collecting a survey form. Each survey form will be having a data about all the primary data will be there. Then this survey form, you will be having survey number and the house number. Then there should be a consolidation form will be there. So survey form will be one big form will be there, that is called survey form. In the consolidation form, there will be a one form. This one, for example, this is the form number 1 will be coming in 1. So all the data over here will be given here, like how many under 5 children, all these things. So the one form data can be transferred into the consolidation form of this one. So how many children are collecting, how many houses, those houses will be coming. Then when you count this one, you will get the data, or you will get the information about this information, you will get it, or this information you will be getting it once this form has been collected. So we have to teach the student nurses. We will not be able to collect this much area, but you have to teach the student nurses, because future they are going to work in a primary healthcare center and other under the government. So what is called this form? Survey form. The survey form, how it has to be interpreted into consolidation form. From the consolidation you have to total it. Then this data has to be put it in a form of a pictorial representation. After putting a pictorial representation, if you want to interpret in that particular area what is growth birth rate, infant mortality, newborn mortality, perinatal mortality, maternal mortality, this formula, numerator, denominator, with that they can find out what is the particular rate. Hope you understood. Thank you very much.